The child's immune system is the body's natural defense. A healthy immune system recognizes foreign substances like bacteria and viruses as being different from normal body tissue. It then acts and destroys them. When working properly, the immune system allows the child's body to fight off infections. Allergic reactions can occur when the immune system overreacts to a substance called an allergen. Some common things that can cause severe allergic reaction in children include insect or bee venom from bites or stings, nuts, some medications including antibiotics, berries, eggs, and wheat. Allergic reactions are usually mild. However, some children may experience a much more severe allergic reaction when exposed to certain allergens. This severe reaction is called anaphylaxis. Anaphylaxis will affect many different systems. In the lungs and throat, swelling can occur. This can cause wheezing, difficulty breathing, or swallowing. Massive itching and swelling can occur all over the body. Swelling happens quickly and may be particularly severe in the hands, lips, face, tongue, and throat. The child may also vomit, have diarrhea, be bent over with abdominal cramps, or complain of metallic taste or itching in the mouth. The child may also feel faint, complain of a racing heart, become extremely pale and sweaty, or even pass out. Because anaphylactic symptoms can progress very quickly to an emergency situation, if a child in your care has any of these symptoms, call 911 immediately. There are many things you can do to keep children away from allergens. Be sure you know all the allergies of the children in your care. You can't protect them from what you don't know about. Second, if you have children with food allergies, avoid having that food available in your program. Third, be extremely cautious when outside because insect stings can occur throughout the year. Epinephrine is the medication that, when given as an injection, can help relieve the symptoms of anaphylaxis and can save the child's life. If a child in your care has known allergies to bee stings or certain foods and has a history of anaphylaxis, the child's health care provider will probably prescribe epinephrine to be kept on hand. In this training, we're only going to cover giving epinephrine using an auto-injector device, such as an EpiPen or AV-Q. Remember, epinephrine is a prescription medication that is for a specific child. If a child in your care is having symptoms of anaphylaxis and does not have an EpiPen or AV-Q, get emergency help by calling 911. You may not use one child's epinephrine auto-injector for another child under any circumstances. Anaphylaxis progresses quickly and requires prompt action. Store epinephrine in a place where you can get to it quickly, such as the first aid kit, or in the emergency bag you take outside with you. Also, don't refrigerate it. Instead, keep it at room temperature, and don't expose it to extreme heat or direct sunlight. Although many children may have a prescription for an epinephrine auto-injector, they are rarely used in childcare, so be sure to check the written medication consent form and expiration date on the medication periodically. And always return any expired medication to the child's parent.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly...
It's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hive scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
EpiPen and EpiPen Jr. are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Jr. should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Jr., the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube,
Just flip open the yellow cap,
or the green cap,
slide it out, and hold it like this.
Blue to the sky,
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there, but don't worry, your EpiPen Junior auto-injector gave you the right dose, and it has a special feature, the never see needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away.
Call us an ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 EpiPen auto-injectors wherever you go. They even come clipped together.
Because some people might need the second dose.
Take your expired or used EpiPen auto-injectors to your doctor's office and ask for a refill.
Remember, epinephrine is the only first-line treatment for anaphylaxis, not antihistamines.
So just trust yourself and do it. Don't hesitate, especially if you know the symptoms of a life-threatening allergic reaction and have practiced with the great trainer that comes in the box.
Because this is what's important to people like me.
And me.
Use EpiPen epinephrine injection USP 0.3 milligrams or EpiPen Junior epinephrine injection USP 0.15 milligrams auto-injectors right away when you have an allergic emergency, anaphylaxis. Get emergency medical help right away. You may need further medical attention. Only a healthcare professional should give additional doses of epinephrine if you need more than 2 injections for a single anaphylactic episode. EpiPen or EpiPen Junior should only be injected into the middle of your outer thigh, upper leg, through clothing if necessary. Do not inject into your veins, buttocks, fingers, toes, hands, or feet. Hold the leg of young children firmly in place before and during injection to prevent injuries. In case of accidental injection, please seek immediate medical treatment. Rarely, patients who have used EpiPen or EpiPen Junior may develop an infection at the injection site within a few days. Some of these infections can be serious. Call your healthcare professional right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch.
After giving epinephrine, you should immediately start to see the symptoms of anaphylaxis improving. It's common for the child to feel shaky and have a racing or pounding heart. Symptoms can reoccur even hours later. So even if the child seems better, he still needs emergency care. While waiting for emergency help to arrive, call the child's parent. Also, be sure to avoid unnecessary moving of the child and keep him warm and calm. Once the child goes to the hospital, remember to write in his log that you gave him his medication. Throughout this training, we've stressed the importance of matching the 5 rights before giving any medication. But how can you do this in an emergency situation when time counts and you need to act fast? First, you always match the 5 rights when you receive the child's written medication consent form and the medication from the parent. You read the consent form carefully so you'll know what the child is allergic to and what symptoms he might have if exposed. That way, if the child comes in contact with the allergen and has signs of anaphylaxis, you'll be ready to act quickly. Get the auto-injector and make sure it has the child's first and last names on it. Epinephrine comes in a pre-measured dose, and the route of administration is always the same, so you can immediately give the medication to the child. Remember, the directions for giving it are written on the side, so be sure to look at them if you are unsure what to do. Periodically review the child's individual healthcare plan with all caregivers who may need to administer epinephrine in an emergency. And don't forget to complete an incident form documenting the need for outside help. Epinephrine can be prescribed in forms other than a single EpiPen or AVQ. Some children might have an EpiPen 2-pack, which has 2 EpiPens in the box. This is so you have another EpiPen available in case emergency care cannot arrive quickly. If a child in your program has an auto-injector 2-pack, make sure you know if and when you should give the second dose. Anaphylaxis happens quickly. Be sure to periodically review the child's written medication consent form and epinephrine auto-injector expiration date so you are prepared for an emergency.